We have started. We are live.
Okay. So hi Jessica.
Hi, good morning,
Welcome
Karen.
to Diary of a Nutritionist. You're the first one of many nutritionists I'm hoping to have conversations with. And
Okay.
the theme of our conversation is centered around our field of nutrition and the fact that most of our colleagues step out of our field for various
Mm,
challenges, and
mm,
we are we are a needed bunch. Kuna vitu mingi, we have noticed that there's a lot of problems that are related to nutrition, but the services are either not known by people, not appreciated by people, being practiced by people who have not been certified. So there's various challenges in our field, and I would want to hear in your voice what you feel
mm.
like is your story. So how we will go about this is, I will ask you a few questions and we will take it from there. So we'll start
All
with,
right.
tell us who you are.
Okay. So my name's Jessica Wanjuko. I'm a mother of two and a wife of one. I'm the founder of Malkia Nutrition, or rather the co-founder of Malkia Nutrition. I'm a licensed nutritionist and I've been practicing since 2019. That's when I got my practicing license. So since 2019, I in 2019 I finished my internship with Kenya Nutritionist and Dietitians Institute. Then I went directly and launched my company, Malkia Nutrition. So last year we turned 3 years. This is our fourth year in practice. Yeah, so that's Jessica. We have um, our offices in Westlands at Occidental Plaza, and we have a team of we have three interns and three directors, so we are six. Yeah, three interns and three directors, and I'm the practicing nutritionist or the head nutritionist. We have a psychologist and a data scientist. Those are the founders, and they form the basis or the pillars of Malkia because we have different aspects other than nutrition consultancy. Yeah.
Okay. So you said you formed officially, or rather you became a nutritionist certified in 2019. Um,
Yes.
Prior to that, was this something that is it a dream you had to always be a nutritionist, or how did you end up finding yourself in this field of nutrition?
Okay. So let's go back to high school. I didn't
Yeah.
necessarily think of being a nutritionist. But at that time when I was almost clearing my high school, my mom had she had about nutrition consultancy. So personally, I wanted to be an engineer, electrical engineer. But around that time, she had about nutrition, and she told me, don't fill your papers while in school. The campus, the job, it was job back then. Right now, it's called something else. Don't fill them while in school. Come with the papers, then we'll fill them after you get your results. So that's what I did. I picked my papers, and once the results were out around February, it's when I applied. So I knew I wanted to come to the University of Nairobi, but I didn't know. I was a bit fluid on which course. So I applied for different engineering courses. Of course, the topmost was University of Nairobi. Then the fourth, which was literally the sixth option, was nutrition at the University of Nairobi. And as fate would have it, or as God would have it, that's what I was awarded. That's what I was awarded. And we came, we came to the university at Chiromo. We tried to change it. And then we met some professors who were like, it's okay. It's a very good course because even the entry grades were really high. So they convinced us that it was a good course. And so I kind of had peace to pursue the course. And after I registered, I didn't try to change it again. but my colleagues tried to change a lot. So I didn't try to change it after I registered. So I did my 4 years. At some point, I think from second year, I started enjoying it. I started enjoying it, and I also realized it's a lot of the things that my mom used to tell me. She is or was a biology teacher. She is a biology teacher
Ah,
because you don't even when you retire, you don't lose the skills. So she loved
yeah.
biology and chemistry. So she had told me a lot about the human body and all those things in an advanced level, more advanced than high school, than what we covered. So when I came to nutrition, and then we started doing anatomy, we did zoology and other courses, I started getting excited about it. And I felt like, yeah, it's something I can do. What I didn't know is that I would practice as a private practice practitioner.
Yeah.
So, like in when first year, second year, even that year, I didn't know. But I did my internship, my what is it called, attachment in a hospital, and that's when I realized I don't think hospital would be the best pathway for me. I'm very limited in what I can practice and what how I can advise clients. So I realized private practice might be the best way. But again, I didn't know how to go about setting up a private practice until I did my internships. During my internship, we had a meeting with the director. We had a meeting with the director of KNDI, and that's where he told us about all the opportunities that you can do as a nutritionist, from diet therapy in big hotels, food processing, private consultation, so many things. So that's where I started now conceptualizing the idea of private practice. That was in 2019. So by the time I was finishing, I chose to do my internship in food science and nutrition as opposed to
Okay.
clinical nutrition, because I wanted
Nutrition.
to diversify. Yeah, because my attachment was in clinical, so I wanted to diversify and see what else is in food science nutrition. So after I finished my internship, I decided to register as a private practice practitioner for clinical consultation, but then I signed up for my master's in food science and technology. So I developed a love for food science nutrition. You get? So I
Yes.
practice as a consulting nutritionist, but I still want to do more in food science, research and the like. Yeah. Mhm.
Okay.
Yeah.
Okay. So just
Mhm.
as a side, um,
Mhm.
because you have mentioned working with KNDI in your whole process, um, I know there's a cohort of nutritionists who came earlier before us, before KNDI was formed, and they didn't have to
Mhm.
go through the process of being certified, doing the test,
Mhm.
or having internships.
Mhm.
So my question to you would be, how do you
Mhm.
feel that having KNDI has made us better as a field of nutrition, or has it really made it better, or has it made it fill in the blanks?
Okay. I would say KNDI has made our practice better, even in the hospitals, because we are now recognized. When I did my attachment, I did it in a I'd say a good place, in a good hospital. I was at Kikuyu PCA Hospital. It has better standards. But in public hospitals, you find that nutrition is not as valued, such that you're not even invited to ward rounds. You're not invited to patient consultations by specialists, right? But with
Yeah.
KNDI, with them placing interns in the hospitals, now the medics are seeing the value of having a nutritionist for their patient consultations and their ward rounds. Because what I learned during my attachment is that nurses used to do a lot of what nutritionists should do.
Yeah.
That's why there wasn't a need for nutritionists. But now, when I said our hospital, even back then, in 2015 acknowledged nutritionists. So when we would go for the ward rounds, you were supposed to have the patient history, just like any other medic, and
Yeah.
you were supposed to have taken the weight, the height, their BMI, because the medication that would be prescribed for this patient was dependent on their weight, on their eating habits,
And their nutrition
on
status,
their
yes.
yes, on their nutritional status. Also, if
Mm.
it was entero, the feeds, if they were
Yes.
doing entero feeds, you had to know the composition of that entero feed before it is prescribed to the patient to know whether
Yeah.
it's high protein, whether it's going to be helping that patient recover or achieve the
The
outcome that
outcomes.
the
Yeah.
medics or the specialists what the
Are
specialists want.
looking.
So
Mm.
I understood the value of nutrition um, consultation even in the hospital, but I also saw the limitations. So I would say KNDI has really helped because by placing people in different hospitals, whether level 4, level 5, even level 3, if you know the national hospital at Kenyatta, the other teaching hospitals, Kenyatta Teaching Hospital, um, I can't remember all of them, but placing interns in those hospitals is helping the medics to appreciate the value of a
Of
nutritionist, and even the
nutrition.
hospital management, yeah, the hospital management to also set up a nutrition office or center. And then what also something that we used to do at Kikuyu is that we would have clinics for diabetic patients, for hypertensive patients, for patients with kidney issues, and talk to them about diet therapy, about the interaction of food and medicine and all that. If it weren't for KNDI, I couldn't have done that. I couldn't have seen that in practice. And I'm hoping more people are taking the internships. I don't know. Our year we kind of did, I think more than 50% of us did our internships. But I think now because KNDI is much more stricter, more people are doing their internships.
Okay.
Yeah.
So we have focused on the earlier bit of your journey towards becoming a nutritionist. So at Malaika
Mm-hmm.
Nutrition, what do you guys do? You mentioned
Malkia,
there's a nutritionist, a data scientist, and a therapist, a psychologist, right?
psychologist.
Yeah.
Yeah,
So
yeah.
what services do you offer? What products do you provide? How can people get this? Just take us through a day at Malaika Nutrition.
Malkia Nutrition. Queen.
Sorry, I keep calling you angels, Malkia, and you're queens.
Malkia, it's Queen, yes. So at Malkia we have 4 pillars. Like when we were brainstorming and coming up with our brand, we came up with 4 pillars. The first one being nutrition education, like nutrition consultancy, meal plans, diet plans, personalized care, what else? All the things that pertain to nutrition, post-surgery care, infant feeding, early childhood care, and all that. So all that, we put it under nutrition education. Then we realized that when we talk to these clients and they have little to no motivation to change their lifestyles, we keep losing them. So we came up with we brought on okay, not we brought on board. We decided to have a mental health specialist or a psychologist who will talk to the client. So this is the initial consultation. Once I do my consultation, our co-director is called Mercy. She also does her own consultation to find out what are the motivations of this person. Are they going to stick to the regime? Are they going to drop after 2 weeks, or will they see it through to maybe say 4 weeks, 6 weeks, whatever I've prescribed? And she also does her own evaluation of the mental state of this person. Why are they
Yeah,
trying to lose weight? Is it they are being bullied? Is it they are being harassed at work? Is it that they have low self-esteem? She finds all those things out, right? Then she also
yeah.
has her recommendations and prescriptions. Then we realized, just a minute, Just a minute, just a minute. So, sorry, we realized
It's fine.
you have advised this person. They are willing to change their diet as per what Mercy has seen. But where will they get this food that you are telling them that is free from pesticides, that is, well constituted, well cooked, and all these things? So the fourth branch was organic farming, because this person needs to eat food that is grown properly from farm to fork. You remember farm to fork? So we realized we need this person to eat the right food and in the right way. Then after that, now we realized we need a way to tell more people, not just the clients we are seeing, but the world over. So the
Yeah.
fourth pillar is information systems, and that is handled by the data scientists. So we are three co-directors, each with their own, uh, avenue, and each of these pillars or branches has so many things to do by themselves. So that's why we keep taking interns. So one intern might be for the data scientist, one for the Mercy, the other co-director, so that they are not overworked or overloaded with tasks. Because all of these avenues, or all of these things, if you take organic farming by itself, it's so broad. If you take nutrition consultation by itself, it's too broad. If you take mental health, so we need a work, what do you call it? We need staff or personnel to work with to achieve everything that Malkia stands for. Yeah.
So, what would you say is unique to Malkia, and which is what I call what is your unique and your beautiful? What is it that sets you apart, and the thing that makes someone want
Stand
to
out.
come to Malkia and nowhere else?
All right. So our unique selling point is that we offer individualized consultation. We don't have a
All
fit
size fits
all
all.
and a model.
Yeah.
Yeah, we don't have a all size fits all. We individualize it to you. And then we also go beyond, as I explained, we go beyond giving you a meal plan to go and follow. We do very, very intense follow up, and also we bring in the mental health specialist, because motivations and diet and habit forming is not my specialty, you
Yeah.
see. But for Mercy, she knows how to prompt you, how to check on your progress in a way that you won't lie, that you followed the meal plan and you didn't. So we offer a full package that is very individualized to each client that we see. And we do intense follow-up to make sure at least the client hits the 6 weeks mark, and they are now on their way to achieving their health goals. I would also say our location is ideal at Westlands, and yeah, many people find it easy to locate us and to come to our offices.
Okay. So, what would you say
Yeah.
is your mission and your vision? Then, what is your main goal when you started something you had in mind, and what are you envisioning to with all these activities you're doing? Because there's your why. What is your driving why?
So my why for Malkia, like way back then, was that we can help households or enable households to live an active and healthy lifestyle. When I say household, we target people from around 25 years to 45 years. It's not like we don't talk to kids or to older people, but you have to have a target group. So our target
Yeah.
group is 25 to 45 middle income earners. Let me explain why all that. One, this 25 to 45 is person who probably has a household. They have kids, or they have a household. They are not living alone. We assumed, this is an assumption, that this client has children and this client has parents. So if they have children, they will affect their child's well-being. And if they have parents, they will also influence whatever their parents are doing or eating and the kind of lifestyle they are living. So we found this to be ideal. If I reach you, Karen, I'm assuming you have kids. So if I educate you, you will change your kids' dietary habits. If I educate you, you will change your parents' dietary habits because you'll tell them, oh, I learned about this and this and this. I learned about this product. I learned about this doing things this way, and I would like you to try it. Yeah. Also, something I forgot, we have a range of products. Once we started organic farming, we realized now these things have to be put out in the market. So we have a
Market,
range
yeah.
of dietary products from chia seeds, baobab, fenugreek, fennel, all those things. So, but this is also an aspect that, so when I said organic is broad, it's now we realized we can't grow all these things by ourselves. We
Yeah.
have to aggregate from other organic farmers. So from that, we formed the organic farmers markets. So we have one in Kikuyu, we have one in Karen. So now we have a place for clients, even if they are not sick, to come and buy organic products and tell others. But these are just a few. These are the ones that me as Malkia or us as Malkia are involved in. But I know there are markets in Gong, there are markets in Kiserian, there are markets in Kitengela, there are markets in Adi River. And in one way or the other, we are kind of connected. We are connected because we are trained and licensed by the same body, Kenya Organic
Mm.
Agriculture Network, COAN. So COAN has groups or people who are practicing organic farming in different locations, and we need to keep telling people that this food is available. And if, for example, you come to Kikuyu or Karen, you also get free consultation. When
Ah,
I'm there, if I'm there, you get free consultation. Yeah, yeah. Because yeah, the clients need to have, it needs to be wholesome. We thought, why should we shouldn't drop our clients along the value chain. I can't consult and then go to tell you figure out where to get the food products
yeah.
from. That client would comply. But if I tell them, this is the meal plan, you can go to a certain farmers market, you'll get most of these things. Make it. There's something I learned
Making
when I
sure they
was
have no
reading.
excuses.
They have no excuse, and you make it very easy for someone to form a
Easy,
new
yeah.
habit. I read
Yeah.
Atomic Habits by, I can't remember the author. The Atomic Habits. I also
Yes.
read Tiny Habits. Yes, I'm forgetting his name, but it's Jason someone. Anywho, Atomic Habit says one of the best ways to implement a new habit is to make it as easy as possible. So, say for example,
Yeah.
this is a cup of water. It's not, but if this is my workspace, yeah, this is my workspace. If I want a habit of drinking more water, I should have a water bottle here, a very fancy cup that makes me happy to pick it up and drink from. So I make it as easy as possible for me to adopt that new habit, right? So I'm here trying to consult with individuals who are, say, overweight or obese. I need to make it as easy for them to adopt this new habit of healthy living, or
Yeah.
to adjust their lifestyle to embrace healthy living and a healthy lifestyle. So I consult with you. I send you to Mercy to make sure that you are motivated to change your behavior. I tell you where the products are, and if you are not in that chain and you are beyond my reach, I tell you about this information on all social media platforms. So Malkia Nutrition is vocal on all social media platforms, including, I don't know whether TikTok and Snapchat are social media platforms, but we find
Yeah.
them, they are also good to pass information. They are, yeah, but I know most people don't use them. But we are trying as much as possible, even to go beyond the 25 and below. Remember, I told you our target is 25 to 45,
Is
but we're trying
25
to go
and
to
40.
25 and below. Mm. Yes.
Okay. So what would you say
Mhm.
so far has been your greatest challenge? as Malkia Nutrition, and as you specifically as the nutritionist in your group.
Yeah. My greatest challenge anytime it's breaking the knowledge, the attitudes, and the practices of the people I consult with.
Mm-hmm.
We call them KAP, because people have the wrong information about nutrition. You see, like up to so far, we weren't even acknowledged in hospitals. So actually, people still ask me, unauzanga mitishamba? Do you sell traditional medicine? Are you just a cook? Do you do sijui what? Do you have mandazi and stuff? Do you know how to make chapati? So then they have the wrong information about what
Idea.
nutrition is to do.
Yeah.
Yes. And also there was that time about doctari. Like, will you just tell me to stop eating meat? Will you just tell me to stop eating gluten? You see, so there's the wrong knowledge and the wrong attitude towards nutritionists. And also now the practices of people are really, really off. Then there's that's challenge number one. Breaking that is the hardest. And I'm so passionate about nutrition education, but I know even when I'm on air, wherever I am, it's challenging. It's really hard to break those habits. Number two, it's of course the biggest challenge is funding. Funding, because we have very big visions, very big what do you call it? Very big like dreams and visions and wanting to do so many things and to help so many people and to solve so many problems, but we can only do so much because we don't have
Yeah.
resources, we don't have funding. But also, personally, I also don't push it too much. I don't look for funding too much. I think I should start doing it, but I have been very, very cautious about where we get funded from. Yeah, yeah, but it's still a challenge because I can't do so many things, and I also need to be very careful the partnerships that I form. Yeah, as an individual and as the vision bearer for Malkia, I have to be very careful with who I associate with, who is taking our brand and talking about it. Yeah, so it's a balance. That's why I know funding is a challenge, but I've also been very
Yeah.
slow to look for funding. Yeah.
Have you had a bad experience in partnerships? Is that why you're
Yeah.
cautious? What's the
Yes.
story there?
We ain't ready to share it yet. We share it maybe after a while. Yeah.
Okay. So, what do you
Mm.
think can be done to make nutrition more attractive to people as a field of practice, or just what can be done and who can do these things? Who is responsible for making this
what, what can
journey
what
better?
can be done? We can do a lot. As who For the who, it is us as nutritionists. If someone has had training in nutrition, I really, really wish that we could all practice, because there's a big gap. There's a big gap in private consultation. Those in hospitals, I don't want to bash our fellows in hospitals, but they ain't doing much because of the restrictions. And also, the hospitals are not very strict. You don't have to consult very much. You don't even have to consult as such. You can still, there's a lot of laxity in the hospitals. So I would wish that more nutritionists who have been trained as nutritionists would come and practice, because there's a need. There's a big need, and the need is not in hospitals. It's beyond. It's here in the community. It's here where our parents are retiring to. It is here in the villages where no, even doctors don't reach. And there's a big need. So the people who can do it is us as nutritionists. How we can make it more attractive is, as individuals, we agree to pay the consultation fee without bargaining.
Yeah.
Because yeah, we agree to pay nutritionists, because I think that's why many people don't come to practice. They're like, I'll be paid 500 per consultation. It doesn't make sense when you
Yeah.
don't pay a nutritionist as well. and we have gone to hospital, to school the same way as most other professions or professionals, and we have a lot of knowledge in human health. We ought to be paid well. So KNDI ought to push for us to get paid well in hospitals and other institutions. If not, we need to convince people to pay as well. Yeah.
What would you say should be a standard rate a nutritionist should be paid?
For me, I charge 2,500 per session, which should be less than an hour, non-negotiable. Like, if you ain't paying that, look for me when I'm doing free consultations. Like, and that package, because we offer, so I consult, Mercy consults, and we do a diet plan. So our initial is usually like 5,000, but you can take what you want. You can say, I'll only see the nutritionist, or I'll only see Mercy, or I'll only take the meal plan. But if we do that, and these individual services are not, they are more than 5,000. But if you take them as one, we give it at 5,000. I know it's a bit high, but doctor's consultation, my friend, I have gone to hospitals, they charge 3,000, and you are there for 15
Yeah.
minutes and you don't even get the right answers that to the questions they don't even give you answers anyway. So yeah, for me, I charge 2,500. Mercy charges around 2,000 to 25 as well. Standard meal plan is 1,500, but when you take the package as one, you get it at 5,000. But that being said, I said I offer a lot of free consultation whenever I'm in the market, whenever we're having good moods. Not really. Whenever we are in the field, we don't charge for consultation. Yeah, and we target, like,
So you do
when I
that
say in the field.
as a way of marketing.
Yes, yes, yes. And also giving back. Because the people we meet are our parents, who I kind of feel obligated to share my knowledge with them, because no one else might come to tell them at you need to eat like this. And if someone who is struggling maybe with diabetes or hypertension, and they still don't know what to eat or how to eat it. So when I'm in the field, I consult for free, but in the offices, it's 2,500 minimum charge. Yes.
Okay.
Mm,
It has been interesting having this conversation with you. I look forward to
mm,
talking more. I don't want to
awesome.
eat any more of your time. So thank you
Thank
for your
you.
time.
All right.
Yeah, and keep up the good work. It's not an easy journey. I know I have been in the field since 2016. I have tried everything from working in a hospital to starting a practice and shutting down. I have been in and out, and I have been talking to different people. As I mentioned in my class, I think there's only two of us who are still practicing in nutrition. And I know there's a
Mm,
gap because people need to accommodate nutrition in their everyday life because everyone eats. There's no one who doesn't eat, so everyone needs nutrition, so everyone needs a
mm.
nutritionist somehow. So if we can
And
get
then
our,
as
I
well.
call it, yeah, if we can get our gospel out, then the
Mm,
better for our nation. Yeah, then we can be
that's true.
contributors to healthcare. And my hope also is that beyond these conversations, we can be able to start influencing policy because um,
Yeah.
other than when the formation of KNDI constitution, when you look at in our Kenyan constitution, there's not much that is spoken about nutrition. We talk about every other sphere
Mm,
of health, but nutrition is not
mm,
mentioned anywhere. So we need to give
yeah.
ourselves as practitioners a voice. And I am
Mm,
hoping some of these conversations is going to trigger some of that voice. We will start to
policymakers.
get louder
Yeah, but
and yeah. So thank you for your
it
time,
it
Jessica.
is us as nutritionists who have to jump on those policy making panels. We are the ones who have to push our agenda. And it's not only KNDI, there's also the Nutritionist Association of Kenya. There are some other bodies that support nutritionists, but we need to be known. We need, like, when someone hears Nilishe Health, they know that you are a nutritionist. When they hear Malkia, they know this is a nutritionist, just like how people know other brands, that they don't have to think, oh, what do? They know. Yeah, people need to know there are lots of nutritionists on the ground. Okay, I really have to go. Thank you so much. It was lovely talking to you, Karen. We can do this
Yeah.
again, definitely. Yeah.
Okay. So enjoy the rest of your day.
Thank you. Thank you, and you too.